School is back in session. You all know what that means? That's right, it's parasite season. Last week we had a couple kids with itchy bums who turned out to have pinworms. What will you do if your child comes home with an itchy scalp? You all know me, I'm Dr. B, and this is the buzz on head lice. Head lice are a common parasite that infests the scalp. And when you have head lice, we call that pediculosis. Humans have been getting lice for at least 4,000 years. And in that time, there have been a lot of myths about lice. So let's just clear up the big ones right away. Head lice are not a sign of poor hygiene. They do not prefer dirty hair. They cannot jump or fly, and they do not transmit disease. Lice are annoying. There are social stigmata attached to having lice, but overall, they are pretty benign. So let's take a look at some lice and their eggs so you know what to look for. First, let's look at lice eggs. Unhatched eggs are called nits. They're oval, white or yellowish, and they're very, very small. Here's one next to a match head. That's how incredibly small they are. Nits are laid very close to the scalp and they're glued onto the hair strand. They're often mistaken for dandruff, but unlike dandruff, they can't be brushed off easily. These are obviously extremely bad infestations with lice. These little white dots are all eggs. Usually when we see nits, we see at most a couple dozen because the kids are scratching a lot and the parents want to make sure they don't have lice. Eggs hatch in about 7 to 10 days after being laid, and the adult lice take about 1 to 2 days to mature, and then they start laying eggs again. Adult lice are about 2 to 3 millimeters wide, about half the size of a grain of rice. They are tan to gray-white, and they're very fast moving, so they're actually pretty hard to see, especially in lighter colored hair. Here's an adult with eggs or nits stuck to hairs so you can compare all the sizes. And here's a nice close-up to give you a better idea of what they look like. Look at those little claws for hanging on to human hair. They were designed specifically to attach to human hair, which I think is pretty neat. Lice feed off human blood, and the bites are small, red, raised bumps, usually on the back of the neck and behind the ears. And because the bites are itchy, another sign to look for is scratch marks like on this person's neck. Symptoms of lice infestation include itching, a tickling, crawling sensation on the scalp, and I'm sure that if you're looking at this picture, you may be having a tickling, crawling sensation on your own scalp right now, difficulty sleeping due to those feelings of itching, and maybe some lymph node swelling if they've been scratching at the skin and maybe got a little bit of bacteria in the skin from all that scratching. Kids that get lice are usually early school age, maybe 3 to 12 years old. Usually the transmission occurs through direct head-to-head contact. Transmission by sharing brushes, hats, pillows, clothing. It is possible, but is much less common. The best way for us to make the diagnosis, or for you to make the diagnosis, is by seeing live adult lice on the head. Seeing nits is not proof that someone has lice because a lot of times the nits can be mistaken for other things like dandruff. But now that you know what to look for, you should be able to identify nits, and if you see some lice, then it's pretty obvious what the child has. First line treatment for lice is all over the counter now, so you can take care of this without a doctor's help. There's pyrethrins like RID or Nix, which contain insecticides that are derived from the chrysanthemum flower, which kills the adult lice. This medicine is applied to dry hair. It's left on for 10 minutes and then it's rinsed off. Then what you want to do is comb out all the dead lice and all the nits you see. And it's important to get these out because these over-the-counter medicines don't kill all the eggs. The second treatment is recommended 7 to 10 days later to kill any newly hatched lice from those nits that survived or were missed when you were combing them out. Adult lice do have some resistance to these medications, but if they don't work, it's likely due to improper use or reinfestation rather than resistance to these medicines. Now, my favorite medicine is called ivermectin, or Sklice, S-K-L-I-C-E is a brand name. This was a prescription-only drug until the last few years, and now it's over the counter and it works great. This is the generic version that you can get at Wally World or grocery or drugstore. You apply this to dry hair and you rinse it off after 10 minutes. It kills adults, babies, eggs. It sticks around for a while, so it has some residual activity for any resistance in the eggs. So a second treatment is not often needed, and it's not absolutely necessary to comb out all the nits. Still, I do recommend combing out all those nits that you can see, but this stuff works great to kill even the eggs. There are some prescription medicines also, like Natroba or Ovide, but these over-the-counter medicines, especially ivermectin, will work great if you use them appropriately. Even though ivermectin kills the eggs, I do recommend combing out all the dead adults and nits because you may still see some that have survived. As far as removing nits, there are multiple products that are supposed to help remove nits. Dimethicone is a chemical that makes the hair shafts very slippery. It may help here. However, the research says that the very most effective way to get them out is by using regular hair conditioner or detangler and a fine nit comb like this one. Often the comb is included with the medicines I mentioned, but you can buy one over the counter. Other things you should do to prevent reinfestation after treating for lice include bagging up soft toys and stuffed animals for 2 weeks, wash bedding, hats, scarves, recently used clothing in hot water and dry it on high heat. If something can't be washed, put it in the bag with soft toys and stuffed animals and seal it up tight. Vacuum the room, upholstered furniture, vacuum the car seat. A lot of people forget that. You don't have to get crazy. You don't have to burn your house down. I have had parents in my office who are just panicking about this, or the child has got it twice in a row and they swear they're going to burn the house down. Please don't do that. You know who you are. Anyway, don't share personal items. Avoid head-to-head contact, obviously. Braiding or pinning the hair up makes it harder for lice to transfer from one person to another. And dimethicone-based sprays like Lice MD that I mentioned earlier, these can help you get the nits out, but they also may help prevent lice from clinging to the hair as they are kind of slippery. And they can be used sparingly during outbreaks. Just spray it into the hair, run your fingers through the hair, and then pin the hair up and put it in braids. And that hopefully will keep the lice from transferring. And of course, keeping an eye out for lice with routine surveillance, especially during the school year, which means right now. That's always a good idea. Like I said, lice are annoying, but they're not really dangerous. The only real complication is if a kid is scratching their head a lot and they get a bacterial infection on the scalp. In that case, if you have impetigo, see episode 37 for that. So a kid gets an infection on the scalp, we definitely need to see that in the office. Otherwise, with these simple instructions and these over-the-counter medicines, you should be able to take care of this at home. Well, thanks for watching today. Remember to like, subscribe, and share. Y'all know me, I'm Dr. B, and this has been The Buzz on Parenting and Pediatrics. We'll see you next time.